Hello everyone, welcome back to Fever with Rash series. Let's start with rubella. Rubella virus belongs to the family Togaviridae and the genus Rubivirus. It is an enveloped single-stranded RNA virus, a spherical virus which carries hemagglutinin. The period of infectivity is 5 days before rash to 6 days after rash. The prodromal features are usually fever, headache, cold, cough, lasting for 2 to 3 days, followed by macular pink rash on day 3 to day 4. Clinical features are lymphadenopathy, fever, and lesions on the soft palate, which are also known as Forsheimer spots, as you can see in the image given here. The complications are usually mild. Post-infectious thrombocytopenia can be seen with arthralgia, and encephalitis can be rarely seen. The management is usually supportive and isolation is needed for 7 days. Vaccine, if given within 3 days of exposure, can prevent the infection. Coming to varicella, it is a double-stranded DNA virus belonging to the family Herpes. Spreads via droplets. The incubation period is usually 10 to 21 days. Period of infectivity is 1 to 2 days before the rash until the rash crusts. Clinical features are again fever, headache, anorexia, and the rash. Rash is pruritic, centripetal, occurs in crops with different morphology and usually crusts within 3 to 7 days. As you can see here, they look like dewdrops on rose petals. Complications include secondary bacterial infections, acute cerebellar ataxia, meningoencephalitis, herpes zoster, and rarely stroke. Treatment is usually not necessary, but oral acyclovir can be used. If very severe infection is present, you can use IV acyclovir. If resistant to that, you can use foscarnet, and if resistant to foscarnet, you can use cidofovir. In chickenpox, aspirin is usually contraindicated due to the risk of Ray's syndrome, and ibuprofen is contraindicated due to the risk of necrotizing fasciitis. Fifth disease is also known as erythema infectiosum, and it is caused by the human parvovirus B19, which is a single-stranded DNA virus, and the most common age group is 5 to 15 years. And after the incubation period of around 17 to 21 days, you have prodromal symptoms like fever, irritability, and which is followed by rash. Rash has a slapped cheek appearance, as you can see in the image given here. Bilateral maculopapular rash on cheeks, which then spreads to the trunks and limbs. Complications include ITP, aseptic meningitis, arthralgia, arthritis. Rarely HLH and non-immune fetal hydrops can be seen in the pregnant ladies. Coming to the sixth disease, which is also known as exanthem subitum roseola infantum. It is caused by the human herpes virus type 6 most commonly, and sometimes by the 7th type. The prodromal features are again high-grade fever, which can be very high and they can cause febrile seizures, cold cough, followed by rash, which is non-confluent, non-itchy, non-pruritic, and usually fades away in 2 weeks. Characteristic feature are the Nagayama spots, which are ulcers at uvulopalatoglossal junction, as we can see in the image given here, and the treatment for this is usually supportive. Thanks for watching, and if you guys want me to make videos on more such topics, please let me know.